When people have a painful shoulder, oftentimes what they're suffering with is a inflammatory condition. Typically it's bursitis or it can be tendonitis. We found that over the years, many people will respond to a cortisone shot in the area where the bursa would be, above the tendon. Typically, we can get the shot in accurately just by feel, but there are times where we've had a tough time getting the right angle, in which case the injection can be painful and difficult, both for the doctor and for the patient. More recently, we've gotten an innovation now which allows us to use an ultrasound machine to guide our injection. This means we can actually see the anatomy in 2 dimensions and get a feel for where we're putting the needle. This way we can watch the needle progression to be sure it's in the right spot before we put our injection in, and we feel we're getting much more accurate results as a result of the ultrasound technique. We're using that in other joints as well, such as the knee, but I think in the shoulder it's made an enormous difference in terms of our accuracy and also in terms of the pain created by the shot, because we're not putting it incorrectly, we're putting it just where it belongs virtually every time now. We use it almost all the time because we think it's a better way of doing it. In addition, it gives us the ability to get a peek into the anatomy. It's not as accurate as an MRI would be, but it's very good for getting a picture of the rotator cuff, the biceps, parts of the joint. Especially in people who cannot get an MRI for whatever reason, we find it's very helpful to have that to be able to get an idea of what anatomy we're actually dealing with.